Hey there, welcome. Thanks for taking the time. Dr. Barry Reid, Mason Spine and Injury Center here in the greater Cincinnati area. Today's topic, concussions. That piggybacks on accidents that happen, motor vehicle accidents, slips, falls, sports-based injuries. There's an article in JOSPT, the Journal of Sports Physical Therapy. This is not a chiropractic-based journal, a medical journal. And this basically states that when people have some type of traumatic injury, an injury in a car, an injury on the lacrosse field, or the soccer field, or the basketball court, or the baseball field, especially the football field, when there's injury to the neck, typically if your neck moves quickly enough to have a sprain, strain, or some type of mild soft tissue-based injury, the likelihood of also having some level of concussion is very high, 90%. The details of this is Journal of Orthopedic and Sports Physical Therapy, October 31st of 2019. And yes, it's a few years old, but it's still relevant. In this office, we see lots and lots of people that have car accidents and other types of trauma-based injuries. Typically, when they present in this office, they say basically the same thing. I just don't feel right. Things aren't quite as easy to do cognitively, mentally. It's not as easy to go to sleep. It's not as easy to remember things. It's not as easy to do regular, typical, day-to-day tasks. It's not as easy to organize their day. What do they need to do first? What do they need to do next? Can they plan? Can they pull off a planned day and execute it like they did before their accident? These types of very simple, very regular, and very reasonable tasks are made much, much more difficult when there are concussion-based symptoms, much less also including some type of whiplash, and that term is not the best one to use, but some type of injury to the neck or even the upper back. So a couple of things that I'd like to do today are expand on how you might know if some level of concussion is present. And these are some very common symptoms. Being distracted more easily. Difficulty with remembering simple things. What did you have for breakfast? What was the last thing that you drank the night before? What day is it? Difficulty switching attention from one task to another effectively and efficiently. If that's difficult, maybe. Difficulty with problem solving. Can you think about a situation and then go about a reasonable level of tasks to be able to overcome that problem or challenge? Reacting slowly to changes or warning signs in the surroundings. Is it difficult to understand what's going on? Taking longer to carry out physical tasks, including routine activities such as getting dressed, getting ready in the morning, or even cooking. Is it difficult, more difficult now than it was before this incident happened, thinking of the right word to use? Is it difficult starting conversations, following them, and understanding what it is that other people are saying? Is it more difficult now than it was before your incident to express your thoughts in an organized manner? Is it difficulty reading non-verbal cues in communication and other social cues that indicate others' thoughts and feelings, regardless, potentially, in some aspects, of what they're saying? Is it also easier to miss jokes or sarcasm? This article, the same article that I mentioned a minute ago, it states that 75 to 90% of the people in this study 5 years ago had concussion-based symptoms 5 years past their injury. If you have questions about how this is working, if you're concerned for a loved one or a friend or a family member or a neighbor who maybe not has the best, maybe there's a little bit of fog or a little bit of lack of clarity, or something's just a little different, whether it's this office or another office, please do me a favor and contact someone who can do the testing, who is proficient in understanding the nuances of concussions and damage or injury to the neck or the shoulder or the back or the upper back. If you've had an incident and it doesn't feel right, then chances are the likelihood of there being something that wasn't there before you had this incident might be helped if you find the right people. Again, thanks for taking the time. If you have any questions on this, please let me know. I can make sure that this article is available for anyone that wants it. And we're always happy to help. Again, Dr. Barry Reid, Mason Spine and Injury Center here in the greater Cincinnati area. Call us today. Thank you.